What do you tell the patient before surgery, and when do you see them back after?
Well, typically patients meet with me for the first time at 3 months after surgery because they have a lot to focus on between right after they have surgery with their diet. So we give them an activity prescription that starts in the hospital with a lot of it is to help them move faster so they lose less lean mass. But also to help prevent any blood clots from forming. So we give them that prescription before surgery for them to do in the hospital, and then they continue that at home. And at 1 month, then they get another prescription until they see me.
So how do you decide what kind of exercise you tell them to do? You have to take a history from the person.
Yeah.
Is it mainly walking? Is it mainly swimming? Is it bicycling? Is it catching a football? What do you tell them to do?
It's whatever they're interested in. A lot of times I like to find out what they have done in the past and what their interests are, and then we just kind of go from there. If they had a bad experience on a treadmill, I wouldn't say to get on the treadmill.
Is it a social thing that you have them do? Do you have to have them go with a person? Do they join up with somebody who's interested in their weight loss? Seems like that's the most effective.
Yeah, you know, studies show that if we have a workout partner, we're more likely to do it. But some people enjoy their exercise time to be by themselves as well. So again, it's whatever kind of that patient makes them tick, what they want to do.
Let's say I was 125 pounds overweight and I was really excited, and I've found out that I can't eat much food, right. And now I'm coming to, what are you going to tell me to do over the next 2 months?
Yeah, over the next 2 months, from 3 months, really, then we'd see them back at 6 months. So for those 3 months, it's about getting 30 minutes of exercise 4 days per week. And that can be a combination of cardio and strength training. And
so you do strength training too?
Yes, we do. It's very important.
Which is more important?
Well, either one. It's really the combination. Cardiovascular exercise to really help burn the excess body weight and fat, and the strength training to help them keep as much lean mass as possible and their strength.
Do you worry about the person when you're doing cardio that you're giving them too much or too little? How do you decide how much to do?
Well, we tell them to go based on how they feel, the talk test, perceived exertion. And typically, you know, if they can do all 30 minutes at once, that's great. But if they need to start at smaller increments and add 1 to 2 minutes a week to their time, they can do that as well.